Hi guys, my name is Maryke from sportsinjuryphysio.com, where you can get online physiotherapy treatment for your injuries. In this video, I'll explain to you what type of exercise is best for lower back pain and how you can decide what you should do and what you shouldn't do. So hopefully by now you know that exercise is a key part in treating the pain in your lower back or upper back or pretty much in any part of your body. And it's for two main reasons. One is movement is needed for joints and muscles and ligaments to be healthy. So if you think about sitting still all day long, you don't have arteries and veins going in and out of your joints. Your joints need movement to get fluid in and out and get their nutrients and oxygen and everything they need to survive. So if you keep your back really still because you're in pain, you're actually not giving it all the nutrients that it needs. The second is that if you strengthen up the muscles around a joint, it can support that joint better and it can absorb some of the forces when you move. Take for instance your hip joint. Up to 60% of the force that goes through your leg when you're walking needs to be absorbed by the muscles that surround the hip. And if they are weak, you can think about how much more force actually goes through the joint. And the same for the back. If your muscles around the spine isn't that strong, the discs and the vertebrae in your lower back will take more of the strain. So what type of exercise should you do? Now, unfortunately, there is no one size fits all. And there are a few factors that you've got to take into account. One is what type of injury you have in your lower back. What type of movements actually make it hurt? So if you can figure out what things makes it hurt and what things are okay for it at that point in time and adjust your exercise, you can usually get away with pretty much anything. And I use the term in that point in time because as your back gets better and the pain changes, you will be able to do different things. That's why it's good to work with somebody who can help and advise you as to what's right for you at that moment. Now, good types of exercise that my patients find useful for increasing movement. Some people enjoy swimming. Breaststroke legs can sometimes be a bit of a problem because of the movement of the hips, but if you're quite careful with your legs, that should be okay. Cycling is a good option for some people. Others don't do that well. If you're not good with bending forwards, then cycling may not be a good option for you. Cross trainer is a good one as well. Just going for a walk works really well for other people, and some people can even run. So it all depends on your specific back. And secondly, flexibility exercises. Now, a lot of people tend to think that the more flexible they are and the more bendy they are, the better for their back. And that's not really the case. Some people who are less flexible and too stiff can benefit from flexibility exercises, but then you can get people on the other side of the spectrum where they are actually too bendy and need to strengthen up. So it's important to understand which bit you fit into. The other important thing is that if something hurts when you're stretching it, stretching is probably not the way to go for with that. Stretches should be comfortably uncomfortable, so just feel like a stretchy feeling, not like a pain, especially not afterwards. Now, the most important bit is strengthening up. And people are quick to think that they've got to do Pilates or yoga for lower back pain. But actually, the research have shown that bog standard strength training in the gym, like deadlifts and squats and weight training, can be really effective at strengthening the back up. And even for people with disc injuries and nerve root pain down the leg, they've shown that it can work. But the key is that you have good technique first and then have a very graded program of increasing the weight. And in the studies that I've read about this, they've always done it under supervision at the beginning. So it's good to work with a personal trainer or physio or rehab therapist who can show you good form and technique first and then help guide you through the treatment or through the strengthening process. Okay, let me know if you've got any questions. Take care.